I am thrilled to be joined by Congresswoman Katie Porter from the 45th Congressional District here in California. As I told you the other day, you are way up on the Crooked Media Power rankings of members of Congress based on some of your recent questioning. So thank you so much for joining the show.
Absolutely. Delighted to be here.
So can we just start with the basics? People are scared to death. That includes podcasters. We all assume that you as an elected official probably know more than us about how the government is responding or is not responding. What's your sense Monday morning about efforts to ramp up testing and mitigate the spread of the coronavirus?
I actually don't feel that I necessarily know that much more than the American people, to be perfectly honest. Mm-hmm. We are getting regular briefings. I think there's a big gulf here between what we know about the science of this disease and then what we know or are doing about how to respond to it. So, a shout out to Dr. Anthony Fauci, who I think has been relentlessly consistent in presenting the existing science, and that science has actually been pretty consistent. Mm-hmm. What has not been consistent is how the government's been responding, and I think that is where the struggle continues. We have a Democratic caucus telephone call here this morning, and so I'm sure there'll be ongoing discussions about what we need to do, and I've gotten probably a dozen phone calls in the last 24 hours from colleagues who are seeing things in their district and want to be in conversation with me about what do I think we should do about what they're seeing. So I'm pleased that my colleagues are having those conversations with their community in a safe way, often by phone, keeping their distance, but trying to understand what is this really meaning in people's real lives.
Yeah. So let's tick through the government response. I guess I'll start with the most recent first, which is on Sunday, the Fed announced that they're going to slash interest rates to zero. They're going to buy hundreds of billions of dollars in bonds. Now, obviously, that's not a healthcare-related response. That's a stock market response. But can you help explain to listeners in kind of basic terms for dumb people like me, what does that mean? How does slashing interest rates and buying bonds help, your average person on Main Street?
The idea behind the quantitative easing, which is what we call some of that bond buying and slashing the interest rates, is to try to make the cost of borrowing cheaper, which is an issue as we're going to be asking, and we're going to see businesses needing to take on lines of credit. We're seeing retailers who are drawing down on their lines of credit right now to be able to continue to pay workers even as they don't have revenue coming in the door. So that's a monetary policy tool. It's designed to help stabilize the markets. And even if you don't have any investments, you're not in the stock market, you're doing your best to just, get to the grocery store and pay the bills like most of us are, this is still a good thing. Widespread market panic doesn't benefit anybody, even those of us who don't have a direct connection to the market. At the same time, I would just say, while I'm fine with what the Fed did, and I think it was probably appropriate, it is not a substitute or an excuse to misunderstand that the heart of our economic defense against a recession is American families. It's American workers. And so we do need to be putting cash in the pocket today of American workers who are going to be, their hours are cut. They're being told not to come into work. They're not being paid. Businesses are not having revenue. All of those things are happening. And so I support immediately delivering cash to every American worker. We can do it right now. We can use the Treasury Department and the IRS to administer that, and it's incredibly important. I think we can have a debate about how much money, whether there should be categorical restrictions for workers that we know are still getting paid, for instance, state workers or government workers. But if there's one lesson from the foreclosure crisis, which I was in the thick of, is that if you try to means test programs and you make the paperwork complicated and you create 10 million eligibility requirements, you really can kill people from paper cuts. I mean, the 1,000 paper cut deaths economically is a real thing for American families. And so I urge my colleagues, one, to prioritize American workers. They are the front line in our economic stability. And two, to understand that we are all in this economically together, just like we're all in this together in terms of physical health.
That's a good way to think about it. So again, working backwards, the House, the democratically controlled House, passed a sick leave bill quickly, and I think they deserve credit for moving quickly. But a lot of people are angry or confused why companies with 500 and more employees were exempted in that bill. So I mean, I guess the question is, why does a small business have to offer 10 days of paid leave, but McDonald's or Amazon does not? And are you worried that, exempting those companies might limit the impact of social distancing efforts, since, big companies employ, I think, about half of American workers?
I'm going to do something that's probably rare, even on the Pod Save America format, and just directly answer the question. We failed. The reason this happened is because of Secretary Mnuchin and the Trump administration. So when you say, why did this happen? Let's be clear. The House Democrats went in. We wanted to provide 10 days minimum of paid sick leave. We talked about 14 days of paid sick leave for all workers. And after 2 or 3, 4 very intense days of negotiation, late nights in the Capitol, 1 a.m., 2 a.m., hoping we were going to vote, this is the deal we got. And it's really an example of putting the largest corporations ahead of small and medium-sized businesses. There's just no rational explanation for why you give the biggest employers, those that have the most flexibility to accommodate sick leave and the most ability to afford to pay sick leave, to let them off the hook here. It's simply, for me, it's another example of money in politics. It's another example of bailing out the too big to fail, those at the top, and leaving behind those in the middle and the bottom who get squeezed. So I think the next bill the House passes, we need to go back to our core principle here, which is that paid sick leave for all workers is a necessity. I think the sick leave portion of the Families First Act is actually the weakest part of the bill. Some of the other portions of the bill I actually think were extremely well done, and really some credit should be given to House Democrats and Speaker Pelosi for achieving, because we're already seeing them make a difference right here in our communities.
Yeah, I mean, so I don't mean to focus on the economic piece of this, because I think that the health piece is so much more important. But honestly, that's seemingly being left to governors and mayors and state-based health authorities to deal with. So I'm just not sure what to even ask you. But so I guess sticking on the questions about the financial impact of.
Well, Tommy, can I give you an example of where this bill, the Families First Act, is going to make a difference?
Yes, please.
And it's making a difference right now. So while I'm disappointed with the sick leave provisions, I think they help, but they don't go far enough. We also included in the Families First Act $1 billion in authorized funding for food assistance. And this is for things like senior nutrition, Meals on Wheels. It's to expand the school lunch program. Right here in Irvine today, we passed that bill in the middle of the night on Saturday morning. It was like 1 a.m., 12:45 in the morning, middle of the night between Friday and Saturday. Today, Monday, the school district in the 45th Congressional District, Irvine Unified, is open right as we speak, distributing school lunches on a drive-up basis to any child who needs it.
That's amazing.
Any child. And so that is possible because the school district believes it knows that there's going to be that additional funding for the school lunch program. So there is real help that's being delivered here, but I think what we found is where the government's willing to foot the bill and we have great partners like our local school districts, we can make a difference in American lives. When it came time to ask the largest corporations in the country to step up and take care of their workers and be part of this pandemic response, we were met with resistance from the Trump administration, and it's incredibly disappointing and frustrating. And I hope the American people will push back, both on their government representatives, but also in terms of calling on American businesses to do what's right here.
Yeah. So, I mean, you are like one of the foremost authorities on financial issues. You wrote a textbook on consumer laws. You were tapped by Attorney General Kamala Harris at the time, then Attorney General Kamala Harris, to be the state's independent monitor of banks in this big mortgage settlement. What lessons did you learn from those response efforts that you think we should be thinking about and getting ready to apply to the likely fallout from the coronavirus?
So I think first and foremost, there can be no unconditional bailouts of industry here. We need to make sure that we're getting workers and families taken care of first. Their voices are more diffuse. And let's face it, in our current political system, at least with a lot of my colleagues, the big corporations have more of a say and more of a voice than everyday families. So we need to put workers and household well-being first. If we stabilize the economies of each of our households, then that has the strongest possible macroeconomic effect that we could have. The second thing is we cannot dither and waste time with means testing. We can't be spending time worrying about whether this person or that person deserves help. Just like everybody is at risk of getting sick from this pandemic, everybody is going to be hurt by a major, serious, prolonged economic downturn. So the goal here is to get help out quickly. To go back to the foreclosure crisis and remind people, President Obama and his team came up with a foreclosure prevention program, making homes affordable. It was variously called, had components called HAMP and HARP. There was really, in my opinion, nothing wrong with those programs. The problem came in that the qualifications, the paperwork, the limitations, the who got help and what they had to do to get help meant that nobody, particularly the most vulnerable, didn't get help for literally years from when that program was enacted until when it began to really be ramped up and be operational in an effective way. And so there's a huge lesson here for us about the need to develop government programs that we can implement to help families just as quickly as the Fed can implement a 0% rate cut to help the Wall Street banks and the macroeconomic market.
That's such an important point. I mean, there are so many moments in our history where you can point to the cruelty of bureaucracy and how it prevented people from literally having their lives saved. So I think that's an incredibly important point to keep making. A lot of people recently saw this amazing clip of you just relentlessly, doggedly questioning the head of the CDC during a congressional hearing. You finally got him to commit to making the coronavirus test free of charge. First of all, thank you for doing that. Second, have they followed up with you about implementing that promise? And why does it take a dogged member of Congress to get the CDC to agree to do something that seems so obvious?
The government has quite a bit of authority here to respond. One of the most fascinating things about that moment, for me, sort of the backstory of it, is that statute that we were asking him to use, that rule, it's been on the books since early 2017. Government actually did its job here. Previous administrations and Congress and the folks who do this work, they promulgated that rule. But then when it comes time to respond, nobody wants to use the existing authority to just get it done. And particularly in this case, my colleagues, Rosa DeLauro and Lauren Underwood, we had written a letter a week before that hearing, more than a week before that hearing, asking the CDC director to use this authority. No response. The hearing starts on Wednesday. They have to shut the hearing short. I'm the second to last person to question. I'm at the bottom of the pecking order in Congress. They cut the hearing short. They leave. They come back the next day. That night before they came back, we contacted the CDC and we said, we are going to ask Director Redfield to commit to using this existing authority to make sure that testing is free regardless of insurance. I have never in all my years as a professor given a student the answer in quite that way.
Yeah.
And he still fumbled it.
Right.
And so I think this is where leadership really matters, and where reminding government authorities like the CDC director, the responsibility that they have is a heavy one, and they need to be using the tools that they have, just as Congress has an obligation to be thinking about creating and implementing additional tools.
Yeah. Congresswoman, I don't know if you watched the Bernie Biden debate last night. I mean, it was weird for a lot of reasons, right? It's weird to have just the two of them, no audience, social distancing happening in real time on that stage. But it also just felt like we're in a new political context, and so I'm still wrapping my head around it. But the big divide was sort of Biden saying, let's respond narrowly to the crisis at hand and get through that and take care of families that are impacted by this immediate need. Versus, I think, Bernie's message, which is like sort of harkens back to Rahm Emanuel saying, never let a crisis go to waste. We need to reform the entire system. This is laying bare how broken our healthcare system is. It's laying bare the vast amount of economic inequality in this country. That means, the average family can't pay a $400 bill or go bankrupt. So it's really a philosophical change. Like, do we need to manage the crisis, or do we need big structural change, as Elizabeth Warren might say? Do you have a view on that debate in terms of what we should do now or how to approach this?
Both. We need both. So there are some things that we need to be doing right now in the immediate, and hopefully one of the lessons of those things is that these are just good ideas. So one of the things, just to use a small example, it was not a small example, but to take one issue that would actually make a big impact and see how this plays out. Paid sick leave is a benefit to both workers and employers. It actually saves employers money in the long run. We should have paid sick leave, period, regardless, going forward. Mm-hmm. But there's an opportunity to use this moment to get people to enact it. So one of the things I'm really watching is, are we saying you have to give paid sick leave for the next month? Are we saying you have to give paid sick leave only for coronavirus? And so I'm seeing some corporations say, well, we'll do sick leave for those who get affected by coronavirus. And I'm thinking, well, what if they just have cancer?
Right.
They need paid sick leave. And so I think this is not actually as big of a contrast as it might seem. I think it's a little bit of a difference in sort of how to frame it. Mm-hmm. But the correct answer here, in my view, is that most of these policies are good policies to have in place. And paid sick leave, I think, is really a critical example of them. But I'll offer you another one that's a little more, it may seem a little more abstract, but it's one that I'm thinking about a lot, is Congress, which is very eager to put burdens and responsibilities on government, local government, state government, onto businesses, onto Americans to deal with this pandemic, to be flexible, to implement social distancing, to plan for continuity of operations, to facilitate telework. But Congress itself does not have continuity of operations plans. So we don't, and I'll give you the big example here is remote voting. Mm-hmm. It is very possible that folks like me will not be able to travel back to Washington to take our next vote. Our governor here in California, Governor Newsom, just called for everybody ages 65 and up to home quarantine for the foreseeable future, for an unknown period. Our California congressional delegation has 20 or more members who are over 65, including Speaker Pelosi,
right,
including some really important figures, committee chairs, people like that. So Congress needs to make sure that we're not accepting ourselves from either the need to ensure continuity of essential services, and we're not accepting ourselves from basic public health safeguards. Yeah. Most people, I think, have seen one or more pictures of the House floor during voting.
Right.
It is 435 members and 100 plus staffers running all over, touching the same voting machines in close proximity. We should implement a remote voting procedure, one, because it's maybe necessary in this pandemic. Yeah. But two, because we can't foresee when else we might need it. Yeah. Parallel to paid sick leave. It's a good idea today for this, but we also I think it's a good idea to have a remote voting procedure in place. We may or may not need to implement it, but we ought to be prepared as we're asking businesses and families to prepare. We should not accept ourselves from those standards. And frankly, there's a long history of Congress accepting itself from things, from OSHA regulations, from sexual harassment policies, from all kinds of things. Congress members here should be asked to develop the flexibility in how we do our work that we're asking businesses, schools, and local governments to be doing.
Yeah, I totally agree. Listen, I mean, I was sitting there watching a debate last night and thinking to myself, why on earth are we asking these two 70-plus-year-old men, one of whom will lead the Democratic ticket, to be together, to be in, not in their homes? And I'm sure all kinds of procedures were taken to keep them safe. But the other thing I keep obsessing about is people are going to go to the polls on Tuesday, including lots of seniors. And I obviously, look, the darkest regions of people's brains are like, what if Trump suspends the election, right? And it's very easy to get conspiratorial. But I think in the near term, you have a lot of older voters who want to exercise their right to vote this Tuesday, tomorrow, and they're wondering, is this safe? And I don't know what you think we might do in either the near or the long term to address that.
So I think our mantra here that's coming out of this conversation for me is things that are a good idea today because of this pandemic and because of coronavirus, were actually, a lot of them were good ideas yesterday and are going to be good ideas tomorrow. Paid sick leave, the possibility of remote voting, voting by mail. This was a drop-off ballot boxes that you can drive through. This was a good idea yesterday. We have it in California.
Yep.
Everybody in Orange County received a vote by mail ballot. This is something we should be implementing actively now. And then it's frankly just a good idea going forward because it's going to help people who on any given election day are sick or on any given election day are stuck in traffic and have trouble making it to the polls. So the solution here, it's hard to implement it for this week. It's hard to implement it maybe even for next week, but we have lots of states that already do voting by mail, including places like Oregon that have been doing it for 20 years.
Right.
So there's a solution here. It's a mail ballot process. It's every reason to think that it's actually more secure than any other method. And so I think this is another example of we have had good ideas out there. We haven't acted on them. And now when we really need them, we're going to have to scramble to make them happen. But the good news is there is a solution there. Just like paid sick leave would help slow down and flatten the curve of transmission. Vote by mail would help make sure that everyone has the ability to participate in our democracy with upcoming elections.
My final question for you, and I agree with everything you just said, by the way, is just how are you doing personally? I mean, a lot of people I think are pretty worried. I mean, I had a moment over the weekend where I heard about a friend who's younger than me, who's in better shape than I will ever be in my life, and who is really having a hard time fighting off this virus. And it shook me to my core, and it made me worry about my mom, who is in her 70s and a smoker. And, it's like it's easy to spiral. And I'm wondering how you're dealing with this anxiety and if you have advice for people listening about how they can too.
Yeah, I think one of the most important things, I have to face this every day because I have 3 children. I'm a single mom. I came home from D.C. I was extremely tired. My mom kept seeing me on TV, and very helpfully, she kept texting me that I looked terrible and looked exhausted. And I was like, thanks, Mom. It took a little bit of work to browbeat the CDC director, so I didn't stay up all night to fight past this bill. But when I got home, I had to talk with my children about this virus. And I think kind of saying to them, look, this is not normal times. Here's what stays normal. I love you. We're going to be together as a family. I'm going to be able to take care of you. We have plenty of food. Here's what you need to do to help. Here's what's going to change. And just trying to walk through and divide in people's mind. I mean, I think we actually used our family whiteboard to make a list of ways that we could change what we usually do to let us still continue to do things, but in a slightly different way. So one quick example is we usually go to the library as a family and check out books and movies. We now signed up for the ebook service, so where my kids are getting books and downloaded books onto their devices. A quick example like that, we now are having FaceTime play dates instead of getting together with our kids' friends. So I think the more people can try to ask themselves, what do I need and how can I get it even while following all of the good public health guidance that we're getting?
Congresswoman, somehow this conversation actually made me feel a little better for the first time in a couple of days. So thank you. I'm so glad that you are in Congress and that people, the administration, if they choose to listen to you, have people with your expertise around to help them make better decisions, because I feel like we're going to be talking about this for a while.
Absolutely. Wash your hands and stay home.
Okay. Thank you so much. Have a great day.
Thank you. Bye.
Bye-bye.